Good day. I'm Pamela Arora, the CEO of AAMI, and we're here at HIMSS on Health Equity Day, interviewing Al Hamilton and Christina Caraballo. We will be talking about interoperability in the context of this great organization, IHE, and I'm going to let each of them introduce themselves, and then we'll get into the details. Al?
Great, thank you. Thanks for having me, Pam. My name is Alfred Hamilton. I am the chair of the HIMSS America Advisory Board. I'm also the CEO of a consulting firm that's based out of Orlando, Florida. So I'm here to kind of help wrap up the discussion about how interoperability, health equity impacts or affects our consumers, which are our patients, and what are the benefits that these capabilities provide to our consumer and patients.
Well, Al is also the chair of the HIMSS America's Advisory Board and also serves on the board for the IHE. Is that correct?
Yes, that's correct.
Excellent. Thank you. And Christina.
Yes, thank you, Pam. It's so nice to be here with you and Al. I am Christina Caraballo. I am the Vice President of Informatics at HIMSS. HIMSS has an initiative for standards development that we do, which is IHE USA. And I am the president of IHE USA and also sit on the board of IHE International.
Excellent. And from the standpoint of this group, a big part of what AAMI does is around standards. We work with med device companies, sterilization as well, as we have those professionals that integrate all that within the hospital walls. What should they know about the standards work that's taking place within the IHE USA?
Yeah, so that's a great question. I'm going to start with what IHE International is. So IHE International is a global community and a nonprofit organization that is focused on bringing profiles into the healthcare setting. And when I say profiles, the magic about what IHE does is that we develop these profiles which are standards agnostic. So we take all of the different standards and the best of breed practices and we put them into our profile so that organizations know how to implement the standards and apply them to the real world. As part of that process, we do a lot of testing through our Connect-a-thons, which is a really wonderful event. IHE International was started by RSNA and HIMSS and has really grown again across the globe. As part of what we do at HIMSS is we run the IHE USA, which is a deployment committee of IHE International. There are multiple deployment committees around the globe, such as IHE Europe is a big one, IHE Japan, IHE Canada, the list goes on. It's just amazing how much we have a global reach within the IHE community. And when we develop things within these profiles within our own communities and deployment committees, such as IHE USA, we feed them up into the IHE International profiles, which can be used and shared across the globe, working on standards-based approaches to solve some of healthcare's biggest challenges.
Yeah, it helps to be able to have those global harmonized standards. It really makes it efficient and safer care. But speaking of the Connect-a-thons, we're here at HIMSS 23 and there's this great interoperability showcase. And I was curious how that fit into the scheme of things and if that might have been a product from some of the Connect-a-thons.
It is. They're really tightly intertwined. The showcase, oh gosh, one of my favorite places on the whole floor, or let me rephrase, my favorite place on the whole floor. The showcase, the interoperability showcase at HIMSS is where you go and see the real stories. This is not vaporware. These are fully tested technologies that are solving some of healthcare's biggest challenges. And they're vendors that may be competitors, maybe partners, but just vendors coming together using standards that have been tested and are ready for real world implementation in use cases for us to be able to walk in as attendees into the interoperability showcase and know that every single connection that's happening is technically ready and can be lifted out of the showcase and placed in different environments across the world, which is super exciting.
Yeah, I did get a chance to look at the showcase. Al was with me at the time, and I will say the enthusiasm with the various parties in this, just reaching out from a collaboration standpoint with these various competitors in some cases, it's just really heartwarming because it is about patient-centered care. And that element came out when we went through that interoperability showcase. It was impressive. Excellent. Speaking of the interoperability piece, do you want to talk about some of the things that are challenges or even some of those competitions and how that all operates?
Yeah, sure. I mean, when I think of the interoperability showcase and where I want it to go, it really is an initiative. So we have the HIMSS Interoperability Showcase during Global Conference. Those are our flagship demonstrations, but they're really all year long.
Mm-hmm.
So we started recording them so that they're available on HIMSS website where anybody can go and look. So
they'll want to
yep.
know that.
If you missed the interoperability showcase, wait for them to be posted because they're all there. They'll be up and live soon. We had recently just started doing this as a response to the pandemic to be able to get information out to the community. And it's just been so well received, and it just really lets us educate throughout the year that HIMSS has invested into getting really great photography now and everything else to do our videos. So really excited about that. Then there's so as I think of the importance of the showcase, it's expanding and making us think about the new things that are happening too. So as we expand the health IT ecosystem, we need to demonstrate how the use cases work from the thought leaders that are doing them. When I think of the expansion of the health IT ecosystem, I think of those that were maybe not part of our meaningful use program originally here in the US market, so our hospitals and our providers, your more traditional healthcare settings. And I think about the full ecosystem. I think about the long-term post-acute care communities, behavioral health, community-based organizations, emergency medical services, which you're seeing demonstrated in the showcase because there are standards that are working today. We just need to get them out into the real world. So it's really an awesome learning environment on what the future should look like.
Well, it's exciting, and certainly from the standpoint of the potential of all the data that's in those medical devices, that connectivity is just paramount, and we'll need it more and more as we try to get smart with AI and machine learning. It's terrific. Al, did you want to talk a bit about the patient-centric care and how this fits with those broader goals?
Yes. So, given that today's Health Equity Day, and the focus is on providing the same level of care to everybody, no matter who they are, where they are, or their background, or any other aspects of the individual. It's important to understand and for organizations to understand and to know how to build capabilities that would not take things into account and treat people differently. And so having standards and having systems that are interoperable via standards gives organizations the opportunity to provide, one, quality care, and two, be able to provide care that is accessible, and the third, that is easily accessible. And the main thing is really how and where people are receiving this care. And we've kind of seen that model flip since the pandemic. We're starting to see, at least there's a lot of talk about care being provided, moved away from being provided from a traditional hospital or a traditional clinic to providing care in the home. And so when care is provided in the home, there might be medical devices that are wearable, like some of us might be wearing a smartwatch that has some medical capabilities on it, not treating, but taking vital signs, or there might be medical devices that are non-wearable in an individual's home that could feed the healthcare provider so that they can get quality care wherever they need it, whenever they need it, and probably most important, in the comforts of their own home. So definitely having these standards and testing these standards and then doing something like this showcase here at HIMSS 23 allows for partner organizations as well as competitor organizations to really test that out before it maybe hits the market so that we can ensure that our patients, the consumer of these products, would continue to receive quality and excellent healthcare.
Yeah, and to follow up on that, you said something really important that I want to make sure we convey. We test these standards at the IHE Connect-a-thon. So we recently, before we came to HIMSS in Chicago, we had a North America Connect-a-thon where these profiles were tested, and then vendors then could sign up to be in the showcase and display the hard work that they've done. We had a really exciting one this past year. We had the Emergency Medical System Group test their profiles at the IHE North America Connect-a-thon, and now they're here in the showcase, which is a new demonstration sponsored by the Department of Transportation. So really
Wonderful.
exciting work.
Oh, excellent. To both of your points, certainly there's been a lot of work that's been done in hospital walls and clinics, and there's home health and telehealth that's been dialing up, especially with the pandemic. As you start to get more consumer oriented, it's almost like a new fold is going to need to be brought in to ramp up their understanding relative to HIMSS and all the capabilities that this organization has to offer. You've talked about all these profiles, Christina. What I'd really like to understand is how that ties into the broader mission of HIMSS. I think you have some thoughts there.
Yeah, that's a great question. Thank you for the opportunity. At HIMSS, health equity is essential to everything we do. It really is our North Star. So one of the things at IHE USA that I'm extremely proud of, and HIMSS is proud of as well, is that we have a maternal health profile that we're working on.
No, that is fabulous. It'll make a difference in the care of those mothers. With the IHE and the Connect-a-thon, are you finding that you're having to educate and bring in those consumer type products that people use in their home settings, or are you finding they're knocking on your door saying, we want to connect, it's important?
Well, I come from the consumer engagement space, so I know some of the vendors and have knocked on their door to tell them to come in.
And they're coming.
Yes,
right?
we actually had a couple.
Thank you,
in the
Christina, for knocking,
demonstration.
because you have to knock, and that's great to hear, because in some cases you have to build their awareness. So kudos to you, Christina.
It's a team. It's a joint effort, but yes, so
Absolutely.
we always want the consumer voice, and the consumer representation. That's something that's been very important to HIMSS, is to continue to advocate for patients' access to data and access to meaningful data so that they can use it.
And that actually changes the dynamic too of those that support the devices, because when it's in the hospitals or the clinics, et cetera, there's a staff there, but there's going to need to be some dynamics of changed models to be able to get that home setting or even school settings, different locations, as far as being able to support those devices. So it'll be interesting. Very good. Well, I've enjoyed this conversation. Is there any parting advice you want to give to the folks at AAMI? I'll start with you, Christina, and then let you have the last word out.
Great.
Yeah, I think it's really important that we build communities of interest to, can I start over?
Sure. I love, first I'd like to hear from you, Christine, then Al.
Wonderful. I think it's really important that we recognize that it is going to take all the full community to build standards. I like to say that I know how to get through the standards advancement process, but I need people that are actually going to be impacted by the standards that we are advancing to help identify what's needed and then be champions along the way so that we can identify the most important, impactful work that needs to be done together and then advance together. And when I say advance, I mean advance for technical readiness, advance the policies and the framework so that once the standards are ready, they're supported through our regulations and our approaches, and people are excited. So we're not having the chicken and the egg effect, but we're really saying we've done this, and when they're ready, we're so excited because we wanted them like a lot more quickly than we actually got them.
Absolutely. And this interconnection between the USA and these other international IHE groups, it also helps with the policy aspects in a number of different locations across the globe. That's terrific. Thank you. Alan, what are your thoughts?
So 3 things I want to mention. One, healthcare in the U.S., in terms of delivering healthcare in the U.S., is probably no different than delivering healthcare in any other country outside of the U.S. Still the same quality healthcare when people need it, where people need it, and how people need it. The second is, as we look at these standards, and I know they could be as complicated as anything else. And so my challenge to vendors is to take those standards, develop applications, tools, devices, et cetera, that are easy to use by the experts, be it the clinician, nurse, doctor, or staff. And then 2, make it easy to be used in the home if it's a home device that's either wearable or non-wearable, whereby it allows the retrieval of that healthcare information to be ingested into a system that can then be used to make actionable decisions by the clinical staff or the provider. And the third thing I like to say is that we don't forget when we develop these tools or these devices is that people come to the table from different parts of the region, whether it's rural communities or it's underrepresented communities or communities of food deserts or communities that may not have high-speed internet. We have to take that into account because it goes back to this equity, right?
Mm-hmm.
And understanding how we could build systems or develop technology that would maximize those deficits by providing the information and data that is needed for clinicians to make actionable decisions that's going to help the patient with their health. And so those 3 things, I think, if we focus on, we'll be able to provide tools, techniques, and technology that will support quality healthcare to all of our consumers or to all patients in a timely manner, no matter where or how or when it's needed.
And great points, especially on Health Equity Day, because if we cover all 3 of those, we're going to be in a great place to really progress health equity. Yeah. I want to thank Al and Christina for their time today and all the great work you're doing in the community. Thank you.
Thank you.
Thank you.